In this video, we're going to be looking at the back squat, which involves squatting with the barbell loaded across the back. Just note, when the barbell's on the back, it's 4 to 5 inches behind the midfoot. Therefore, when we squat, it's normal for the torso to lean forwards to keep the barbell over the midfoot. Now, there are many ways we can perform a back squat, such as a high bar position or a low bar position. In this video, we're going to look at the high bar back squat. There's also different ways that we can perform a high bar back squat. A more conventional squat with the barbell on the back might be a little bit wider, and this comes down to hip joint anatomy and also personal preference and what your current goals are, what you're squatting for, what muscles you want to develop. We might go a little bit narrower for a quad dominant squat or wider to hit more of the adductors, hamstrings and glutes. A powerlifter will usually use the low bar squat, which we'll look at in another video. However, if we are powerlifting with a high bar position, we're going to sit back into the squat more. So it's going to look a little bit more like this. Sitting back into the squat, breaking parallel before returning. When it comes to Olympic weightlifting, we need to achieve more depth with a more upright torso. Therefore, they might take a slightly narrower stance, turn the toes out to open up the hips, and they're going to initiate at the knees, sitting right down, hips over heels, to maintain that upright torso. So just note, there are many ways to perform a back squat. So looking at the conventional high bar back squat, grab the bar, full grip or false grip, head underneath, making sure you're central on the barbell. Walk underneath the barbell in a hip whip to shoulder whip stance. From there, pick the barbell up, short walk out, 2 to 3 strides is enough. From there, we widen our stance, making sure we dig into the floor, heel, big toe, little toe. Take a nice deep breath of air. Pull down on the barbell to create tension. From there, we initiate the hips, so bending at the hips, simultaneous knee bend to drop down into the appropriate depth before returning back to the start position. A few more reps to show the technique. Once you're finished, walk forwards, hit the J-cups and down.